Knock, knock, knock. Hello, Mr. Shapiro. I'm Jenny. I'm going to be your student nurse today. I'm coming in to give you some of the medications the doctor ordered for you. Is that okay with you? Okay, great. Let me scan your bracelet and pull you up in the system. Okay. Can I get your name and date of birth? Okay, that's right. And do you have any allergies? Okay. Okay, so the first one that the doctor ordered is your amiodarone. It looks like you've been taking it for the suppression of arrhythmias. And the doctor ordered a dose of 400 milligrams a day. Does that sound right? Okay. I'm just going to scan this and then open it. So you've taken this medication for a while. Have you experienced any dizziness, fatigue, or feeling tired or a low pulse or anything? No? Okay, that's good. Okay, so for him, I would monitor heart rate and rhythm throughout the therapy and look for prolonged PR intervals, widening QRSs, any bradycardia, arrhythmias, so you and assess for dizziness. Okay, the doctor also ordered you aspirin. Have you been taking that every day? You have, okay. So this is just the kind of to prevent any blockages so that your heart can get plenty of oxygen and blood supply. This is 320 milligrams. Does that sound right? Once a day? Yeah? Okay. I'm going to scan it and I'm going to open it and put it in the cup. And have you noticed any type of bleeding with this medication on your gums maybe, or cuts that don't heal? No? Okay. So do you have any burning in your stomach or upset stomach or heartburn? Okay. No? So that's what we would monitor for, and we'd also prolonged bleeding for 4 to 7 days would also be a risk, and if their stomach doesn't feel good, that would be a risk. Okay, so for your pain, the doctor ordered morphine. I'm going to go ahead and put that in your IV if you want that pain medication. You do? Okay. So I'm going to go ahead and scan it. Boop. It's 2 milligrams an IV push. We'll reassess after 10 milligrams and see, or I'm sorry, we'll reassess after 10 minutes, giving you 2 milligrams, and we'll see how your pain is doing at that point. What's your pain level right now? Okay, that's an 8. Okay, so we'll give that to you. I'm going to be watching to see if they have any respiratory depression, confusion, sedation, and hypotension or bradycardia. If the respirations fall below 10 respirations a minute, then I'm going to reassess the level of sedation. Okay, so then we also have nitroglycerin, and this is going to be given to you to increase the blood flow to your heart and for your chest pain. It is 0.6 milligrams sublingual under your tongue, and we'll give it to you also every 5 minutes, up to 3 doses of it to see when the chest pain stops. Do you want to take this? Okay, beep, I put it in there, and we're going to put it under the tongue, so I'll put it in a separate thing. All right, so with this one, if you feel like your heart's pounding or you get dizzy or a headache's probably pretty normal for this medication, but let us know if any of those things happen. And what I would be assessing for the patient would be assessing the location, duration, and intensity of his anginal pain and his blood pressure and pulse before and after administration. The last one we're going to give you is the vasopressin, and this increases your blood pressure. We're going to give it to you through your IV. It's going to be 0.01 units per minute, and we're going to titrate that to 0.005 units per minute every 15 minutes until the target blood pressure is achieved. I'm going to be looking out for chest pain, dizziness or pounding sensation in the head. Those are some typical side effects. We're going to monitor the blood pressure and heart rate throughout the therapy. So, does that sound good to you? Okay, I'm going to scan it. Boop. Okay, so here are the aspirin, amiodarone, and the guess that's it, aspirin and amiodarone. Here, yep, that's it. Okay, there's those two. And here's some water. And then I'll give you your morphine. We'll give 2 milligrams in your IV. I'll flush it first, then I'll get the morphine, then I'll flush it again. And I looked at the site and I made sure the site was good. And now we're going to titrate the vasopressin. Oh, actually here also under your tongue, you're gonna put the nitroglycerin. And the vasopressin, I'm gonna give you 0.01. So flush, 0.01. And then we're gonna wait 10 to 15 minutes and we'll take your blood pressure again and see how it's doing. And if we need to give you more, we'll give you 0.005 after. Do you have any questions about any of these medications? Okay, we'll reassess your pain and we'll also take your blood pressure and see where it's at in about 10 minutes.